live line, we have Markian Hawryluk, who is the senior Colorado correspondent for KHN, based in Denver. He has reported on healthcare for more than 25 years, writing for such publications as the Houston Chronicle, the American Medical News, and most recently, Ben Oregon. That's the bulletin. And he's on our live line, and we're just so pleased to have him. How are you today, sir?
I'm fine, Cliff. How are you?
Good. Thank you so much for being with us.
I appreciate you having me on your show.
Absolutely. There's so much going on here that you would know about, that our listeners need to know about. Start off. Help us understand what is going on here.
Sure. What we've seen happen in healthcare over the last, maybe 10 to 15 years is sort of a steady rise in the annual deductible that's included in health insurance. And so the way the deductible works, I'm sure a lot of your listeners probably already know, it's an amount of money that you will have to pay out of pocket before your insurance kicks in. So, if your deductible is $1,000 on your plan, and you go to the hospital and you get a bill of, $1,500, you'd be responsible for that first $1,000, your deductible, and then the insurance would kick in and pay the remaining $500 of your bill. But what we've seen that deductible creep up to $2, $3, $5, sometimes even $10,000 in recent years, and you can imagine. I mean, that's a hefty expense for somebody who has insurance to incur after using their health care plan.
Sure.
And this is a part of this is happened with the implementation of the Affordable Care Act, because after that you had a lot of people buying insurance on what we call the individual market. So these are people who don't get insurance through their employer or aren't covered by a government program like Medicaid or Medicare, and they've got to shop for their health insurance on these so-called healthcare exchanges every November. And what the insurance companies have figured out is that most people shop for their insurance based on the premium. So what is this going to cost me every month to have this insurance? And, a $300 plan looks cheaper than a $400 plan every month. And the way that insurance companies keep those premiums low is to shift some of their expected costs to things like the deductible or your copay. Every time you go to the doctor, you pay $15 or something of that sort. So they shift some of that financial risk and some of that burden onto the insured patient. So we have seen these really high deductibles come into play. And for sure, this happens all over the country in, urban and rural areas. But what we found in rural areas was that it was hitting patients and hospitals particularly hard. I'm sure, Cliff, you've probably heard that throughout the country, there have been a lot of rural hospitals that have closed.
Yes.
They just can't make enough money off of the limited population that they have that they serve to keep their doors open. And the high deductible plans have sort of added an additional burden onto these rural hospitals. And the scenario that I'd heard from rural hospitals here in Colorado was, in some of these rural areas, you have these really small hospitals that their job is basically, if somebody gets into an auto accident or has a stroke or a heart attack, they don't really have the same kind of specialists you might find in the big city to treat these patients in this rural hospital. So their job is really to sort of stabilize that patient and then to transfer them when they can be safely transferred to a larger hospital that can do all the high-tech, the really in-depth kind of health care that those patients need. But what ends up happening is when the bills come in, that rural hospital submits its bill, and that bill ends up getting applied towards the deductible. And oftentimes that patient can't pay a $10,000 deductible.
Sure.
So the rural hospital doesn't get paid. The urban hospital, on the other hand, by the time they submit their bills, that patient's deductible has already been met, and the insurance company starts paying the urban hospital you basically, first dollar coverage. They get all their bills covered. So the big kind of affluent area, rich hospitals are continuing to pull in money, and these small, poor rural hospitals are trying to figure out.
So that folks do understand. Our number for those who might have a question for our guest is 312-374-8130. 312-374-8130. This is something that is particularly difficult for a lot of people, as our guest is saying, who is an expert on this issue. What else could be done, Markian, to help try to do something about this?
Yeah, there's been a lot of debate about how we could actually help bring down those deductibles or help those rural hospitals and those rural patients. And one of the main ways that governments are trying to get at this problem is through competition. The healthcare exchanges to purchase their plan, and they're supposed to. The idea was under the Affordable Care Act, it'd be like buying an airplane ticket, and you would log on and see what your options are. Do I want to fly United or American? Do I want to pay for a first class ticket or a fly-in coach? Do I want to have a lot of connections, or do I want a direct flight? And you make your decisions based on what you can afford and what's important to you. Well, it didn't work out that way with health plans because in a lot of these rural counties, people logged on and there was only one plan offered in their county, so it was sort of a take it or leave it kind of thing, and often these plans had high deductibles. So a lot of effort has been made now to try and increase competition and get more insurance companies to enter those markets, so that you now have a choice. Competition in is through a sort of a public option type of plan. This is a plan that's sort of organized by the state government, and they are negotiating the rates. They are setting the rates that they will pay hospitals, and they are asking insurance companies, hey, take these rates and offer a plan in this little rural county, so these people have a choice of a different plan. There's also been other proposals as to how we might be able to lower deductibles. Some of the hospital groups have proposed something called simplified billing, where the hospital would sort of get paid first from the insurance company, and then if there was any deductible to be collected or any copays or something of that sort, the insurance company would just get that directly from the patient. That would help rural hospitals avoid the situation where they've got a patient who they've treated, but that patient hasn't been able to pay their deductible, and so they're not getting paid at all. It might not be something insurance companies are all that excited about, because now they become the bill collector versus the hospital. Some of the hospital associations, on the other hand, have been promoting sort of different scenarios where a lot of the kind of primary care that makes up the bread and butter of their services wouldn't be applied deductible at all. This would be free, just like your flu shot is free now, or some of the other preventive services that you don't have to pay for out of pocket. None of those have really gotten a lot of traction, other than maybe the public option here in Colorado.
And so, at least there is, of course, I think you probably get a lot of credit for this, because you are the one putting out all of the information about what's going on here, Markian. But there is some progress being made. Is that correct?
Yes, I think so. I think there's at least a recognition that this is a problem, and that's, I think, the first step towards trying to address it. as I said earlier, we've seen a lot of rural hospitals close, and when those rural hospitals close, patients where are they supposed to go for care?
Exactly.
Some patients have to drive an hour to get to the nearest hospital now. So we're looking at different kinds of models. Could there be a freestanding emergency room, for example, that doesn't have the costs of a full hospital with it, but is there to provide that emergency care when somebody needs it and can't take that time to travel? And I think we'll see, as when the next elections come around, whatever the makeup is of Congress, I think these are some of the issues that are at the top of their agenda. What will we do with the Affordable Care Act? Will we continue to build on it, or we try to take a different direction?
I think you're right on that. I think you're totally correct. There'll be some people talking about that. Let me ask, this is a show, as you know, that is primarily all just families and everybody else, but also the military. What's the VA doing there?
Yeah, and the VA, obviously there's a lot of veterans that live in rural areas.
Sure.
So this is a huge issue for veterans. And the VA obviously has its healthcare system, it's got clinics, and it's got its own hospitals. But oftentimes those are far away from where veterans live. And so veterans, one, may have the opportunity to visit a local provider and have the VA pick up the tab for that. But of course, if a veteran is in an accident or has some sort of emergency situation, they're going to take them to the closest hospital, regardless of whether it's a VA hospital or a public or private hospital. So they could wind up in a similar situation. And I'll confess, although my dad was a veteran himself and a career military guy,
wow.
I'm not as up to speed on veteran health care as I would have liked to be, but I know it's an issue.
Shape up. He was a career. What service?
Yeah, he was a doctor in the U.S. Army.
Oh, a doctor yet? Wow. Okay.
Served in Vietnam for 2 years when I was just a wee lad, and ended up working at Walter Reed Hospital and the Pentagon and more around the D.C. area. Unfortunately, he's no longer with us, but he gave me a good start in both healthcare and in life.
I was going to say that. Yeah, he may not be with us, but the things he has done are still with us. That's for sure, and that's obvious. Absolutely. That's obvious with what you're doing. Yeah, your dad really served. When we talk about it, he was a physician in Nam in a career. So, do you know how things are going there with the VA at all?
The VA's obviously had its challenges. I'm sure your listeners know this well. That we've had some horribly long waiting lists, and the VA hadn't been particularly honest about the length of those lists. So there's been a big push to reform the VA across the country, and particularly in some of the western states. There's just a lot of veterans living out here, and so obviously we know that the vets have some special needs. And the VA system tries to address those needs as best they can, but I hear from a lot of vets over the years, that they'd like the system to work a lot better.
I don't doubt that, and I'm sure that what you do helps a lot of people understand the fact that there needs to be some more things done, and particularly when you say the VA has had a long waiting list. I believe you said had. Is that past tense? Is that past?
I think those lists are never as short as vets would like them to be, right? That, and I think we owe that to our vets. They served proudly. We should be able to get them prompt and high quality health care. And so I think there has been some movement on that. But as I said, my understanding is it's not necessarily where we would like that system to be.
I'm sure that it is shorter than it would be if it were not for you.
I would like to take credit for that, Cliff, but I can't say I've done a lot of reporting on that issue. Although a lot of my colleagues, a lot of the really good health journalists in this country have tried to shine a light on that problem and try to get some movement on that issue.
Well, we reach a whole lot of people, Markian. We can find out online how many people we reach in other parts of the country and so forth. And we get a whole lot of folks that we really are surprised that we get. We're very happy to. And I'm sure that a lot of folks that hear us do so because of what you do. And I just think it's great because there's a lot of people out there that really need their health and the help that you talk about. And I just want to thank you not only for doing that, for continuing to do it, and particularly to talk about your dad. Wow, doctor in the U.S. Army in Vietnam. That's saying a lot. We just appreciate what you're doing. Give us a closing statement, if you will.
Well, Cliff, maybe I can just tell a quick story about one woman that I encountered that ran into this issue. Her name was Christy Flowers, and ironically, she was actually a registered nurse, and she was about 52, and she'd been sick with the flu for 4 or 5 days. She just wasn't getting any better, so she finally, went to her local community hospital. They diagnosed her with pneumonia and sepsis. Her right lung was just completely filled with fluid, and it was just much more care than that hospital could provide. So they stabilized her. They transferred her by ambulance about 80 miles to a hospital in Colorado Springs. She got put on a ventilator for 10 days, and they slowly nursed her back to health. After about 2 weeks, they sent her back to her community hospital for another week of rehab, and she turned out okay.
That's
but
great.
The bills are what was interesting. She ended up getting $8,000 in medical bills,
Wow.
and a big chunk of that was due to the small community hospital that first treated her. She ended up having to take out a loan to fill that to pay off that medical tab, and that's the kind of issue we're talking about. They're just huge numbers that people are struggling with, and we got to kind of figure out a system to help people and help those rural hospitals.
Keep up the great work. Certainly appreciate
Thank you, Cliff.
All right.